Approximately 53,000 people in the US will be diagnosed this year with oral cancer. Today, we're going to discuss the risk factors, signs and symptoms. 150 new people every day will be diagnosed with oral cancer, and every hour of every day, someone dies from it. That's nearly 9,000 deaths from oral cancer every year. Of the newly diagnosed people with oral cancer, only 60% will live longer than 5 years. Many who do survive suffer with long-term problems like severe facial disfigurement or difficulty eating, speaking, or swallowing. The death rate remains high because oral cancer tends to not be discovered earlier, and we don't see it until its late stages. Oral cancer awareness in the general public is really low. We used to think it only happened if you were a smoker or a heavy drinker. While these are major risk factors, the fastest growing segment of oral cancer patients are with the young people, healthy, non-smoking, due to the connection of the human papillomavirus, known as HPV. In fact, if you have HPV, you're 30 times more likely to develop oral cancer. We can't stop this virus from spreading. Our only hope is to save lives with the involvement of public awareness. This is your opportunity to get involved, give back, spread this information to raise oral cancer awareness so we can find it earlier, because earlier detection saves lives. Together, we have the opportunity to make a difference in the world of oral cancer. If you haven't subscribed to my channel yet, click the red button. I put out videos like this every week that talk about the health-body connection and how you can take ownership of your health. Let's talk a little bit about signs, symptoms, and risk factors. So what are the risk factors? Smoking tobacco is number one. Cigarettes, pipe, cigars, using smokeless tobacco, vaping. All of these things increase your risk of developing mouth cancer by 10 times. 60% of cancers are related to smoking. Drinking also increases your risk of mouth cancer by 30%. Alcohol is linked to 1/3 of all mouth cancers. Smoking and drinking in combination triples your chances of getting oral cancer. UV radiation also causes skin cancer that can occur from natural light, from the sun, or tanning in the tanning bed. Skin cancer can be developed on the lips, often from being exposed to UV radiation, also from the EMFs from your cell phone. So these are all risk factors. Oral cancer can be treated like other cancers. You can learn how to examine yourself for signs and symptoms. If something looks suspicious or a sore doesn't go away, see your dentist or other healthcare provider immediately. It usually starts on your tongue, the roof of your mouth, or in your throat. By the time you can see it, it's probably to stage 2 or 3. And it can look like a little white spot that looks harmless. Ironically, in the dental office, we use an UV light that shines in your mouth to see if you have oral cancer. If we use this light, it looks dark when we look through there. If your dental professional sees something like that when they're doing an exam, they'll send you to get a biopsy. The only hope to save lives from oral cancer is awareness and early detection. If it's detected early, the 5-year survival rate increases by 80 to 90%. As with any cancer diagnosis, the earlier you find it, the more we can save lives. I know I keep saying that, but if detected earlier enough, oral cancer has an 80 to 90% survival rate. The most effective way to manage oral cancer is early diagnosis and timely appropriate treatment. The most common locations of oral cancer are your tongue, tonsils, or your throat, your gums, or the floor of your mouth. Signs and symptoms of oral cancer, which are usually caused by tobacco, alcohol, and HPV, may include a persistent sore or an ulcer that doesn't heal within 14 days and doesn't go away, a red, white, or black discoloration somewhere in your mouth, abnormal bleeding when you touch an area or a sore, a lump or a hard spot on the tissue, on your tongue, in your lips, a sore under your denture that doesn't heal, a lump or thickening that develops in your mouth or around your lips, a painless fixed lump on the inside of your mouth oral cavity on your neck that's been there for more than 2 weeks or doesn't move, a sore throat or feeling like something is caught in your throat, difficulty chewing, swallowing, or speaking, difficulty moving your jaw or tongue, swelling of your jaw or tongue, numbness of your tongue or other areas of your mouth, ear pain even, losing teeth, pain in your jaw or the teeth, a change in your voice, a lump in your neck, weight loss, and even persistent bad breath. If you have any of these signs or symptoms that last for days, weeks, or months, your doctor might recommend tests to check for oral cancer. As with any cancer, having your cancer diagnosed as soon as possible is going to be your best chance of survival. Because oral cancer can spread quickly, early detection is important. The exam is painless and only takes a few minutes. Other symptoms are red or white patches, sores that don't heal, pain and swallowing, lump on your neck. Those are the major ones. You can have a lump in your neck under here, somewhere in your mouth, around your ear. We just want to make sure that you look inside your mouth, around your mouth. Stick out your tongue. Look to see if you see white areas, especially if you're not going to the dentist. Oral cancer could be your worst nightmare. Oral cancer alone in the US continues to be the most dangerous type of cancer because of where it's located and when we find it. Unfortunately, this disease continues to go undetected and it progresses into the late stages, resulting in damage that's irreversible. Certainly, it has a bleak prognosis, and it's not the news that anyone wishes to hear. But remember, it doesn't have to be life-threatening. Look in your mouth. Don't ignore the warning signs. Get it checked out. Look for yourself. An oral cancer screen is something you can do on yourself, or you get at the dentist. You might not even be aware that you're receiving it. Rest assured, it's imperative that we find oral cancer in its earliest stages. That's the best way to fully overcome it and survive it. During an exam, a dentist or dental hygienist will perform this exam in a routine dental check. They'll look at your face, neck, lips, your entire head for possible signs of oral cancer. You might even not know they're doing it. We're looking around your face, head, and neck, but we are checking. Have you ever heard the saying, the best defense is a good offense? That applies here. There are several things you can do to prevent oral cancer. Obviously, lifestyle changes is the biggest one. Giving up tobacco, giving up alcohol, making sure you consume it in moderation if you do consume it. The less obvious ones are taking important preventative measures and having it looked at. Routine oral cancer exams are without a doubt the best way to stop oral cancer dead in its tracks and prevent it from causing more harm both to you, your overall health, and your loved ones. Again, if it's found early, it can be treated with radiation therapy without having it cut out. If it's further along, you might need to have it removed surgically or a combination. Radiation, chemotherapy. The choices can depend on your health, where they find it in your mouth, in your throat, where it began, the size and type of tumor, and where it can spread to depending on what type it is. After a definitive diagnosis, the cancer's been identified, the kind, the stage, treatment is ideally a multidisciplinary approach with a surgeon, a radiation oncologist, a chemotherapy oncologist, a dental practitioner, a nutrition, a rehabilitation or restorative specialist. The actual treatment modalities are usually surgery, radiation, followed with chemotherapy in order to decrease the chance that it spreads somewhere else in your body. Patients treated in the early stage may have little post-treatment disfigurement. If it's caught in the later stage, you might have to remove a good section of your tongue, face, or jaw, or you might lose some of your teeth. So that's why you might need a reconstruction specialist. There are many people that can help you in speech, chewing. It can affect your salivary functions, which is going to affect your digestion and the rest of your mouth. So you can see why an oral exam and awareness, early intervention are key when it comes to finding oral cancer. Get your exam as soon as possible. Do a self-exam. Click the link below to find a PDF of how to do a self-exam. You only get one body. You only get one life. You're allowed to ask questions. Take ownership of your health. Know what's happening in your body. Know what to ask. Because if we can find this sooner, we can increase your chances of survival. Early detection is the best way to prevent oral cancer or treat oral cancer. A healthy mouth is a healthy body and a happy, healthy life. This is a really important topic, so share this with someone else and make sure that you are getting an oral cancer screen at least once a year. Till next time.